Welcome back to Advocacy in Action, the official podcast of the Smart Health Benefits Association. I'm Carolyne Eagan, president for SHBA. We speak on behalf of employer plan sponsors, bringing a boots on the ground perspective to the policy table to help modernize our healthcare and financial systems. Today, we're returning to the most urgent legislative shift by facing the West, Alberta Bill 11. My co-host, Robin Bailey, is here. And in our last episode, Robin, we warned that a delayed implementation was a strategic window and not a reprieve. We now have this hard deadline. What's the street level reality for an advisor right now, Robin?
Well, good to be back with you, Caroline, as always. And I think the street level reality is that the window for passive awareness is over, right? Last time we were saying don't panic, but start paying attention. Now I think the message is a little bit stronger. If you advise employers with Alberta employees, this has to be on the agenda now. And, we were talking a little bit offline before, and Graham had said, October 1st sounds like still a little bit away, but in our world, in the benefits world, that's basically tomorrow. Employers are budgeting, renewals are being prepared. Leadership is going to want to know, what does this mean in terms of costs, compliance, and employees over 65? So in my mind, if an advisor is waiting until September to bring this up, they run the risk of really looking reactive instead of proactive. And worse than that, leadership may be sitting there going, why am I hearing about this so late? And that's really, Caroline, the advisor blindside. This is no longer just an interesting legislative update. This is a compliance and planning conversation. So the right move is to get in front of the client now, explain what we know, explain what still needs clarification, and start the audit process before this becomes a renewal surprise. So I'm really looking forward to hearing from Graham today about this.
Exactly, Robin. And because the Smart Health Benefits Association was officially invited to the Alberta Bill 11 working group, we met with them last week. We went with them today. We're here to break down exactly what employers need to know. And we're joined by Graham Young. Graham is a SHBA board member and our representative on the Bill 11 working group. Welcome, Graham.
Thank you for having me. I always enjoy talking all things SHBA and all things about the industry.
Awesome. Well, you are at the table today and you are in the room representing the employer plan sponsor on behalf of advisors across Canada, and in particular, in this case, Alberta Bill 11. So let's start with the hard deadline. Are there any grace periods for employers who are not ready by October the 1st?
No, so the legislation is clear that it's rolling October 1st and it's hitting the ground. So employers don't have any choice from that perspective. The big question is just implementation, and if anything needs to be updated with your benefit plan and your provider. That's the big question mark now.
Okay. All right. Well, let's move on then. We know what's fact and we know what we can start preparing for. So let's start with the age discrimination provision. The legislation prohibits employers from changing or terminating coverage for active employees just because they turn 65. So what happens if a company hired someone after the implementation date who is already over the age limit, or if they had previously terminated coverage for someone because of their age? What happens?
So if you've already terminated an employee because of their age, let's say you had a health plan that stopped at age 70, for example, and the employee is still actively working at 71, you're going to have to fix your plan to allow that employee to come back on. They've got to enroll and go through that regular process as any other employee. And you've got to allow them to do that. That's what the law is really indicating. You can't discriminate on them because they're over 65. And that doesn't stop at 70, 75, just says over 65.
Right. And what about dependents? Does this over 65 provision extend to them as well?
So this is the real murky part in the legislation. So the legislation really addresses an employee who's working for your organization. So it's not really clear about their dependents. So an example might be if an employee is over that termination age and they're coming back on the plan, does an employer have to bring back their dependents? Let's say they have a spouse, for example, who's also over 65. The way the legislation's written is that it is the employee that you cannot discriminate against. Now, that brings out a whole other round of questions of, if you do not let that other spouse come on, is that discrimination? in another fashion. And we're still uncertain on whether or not insurance carriers and providers are going to sort of give you that choice as well in the structure of the plan design, because that is potentially difficult to manage, just having the employee come on and not the spouse.
Graham, I'm really glad we're having this conversation because, in my mind, this is exactly the kind of clarity advisors need, like what we know, what we don't know yet. Because now we have to turn this into a practical client conversation and begin having those. Because again, we don't want to be sitting there in front of a client going, "How come you didn't tell me about this?" So, Graham, I'll put this back to you. Let's say I'm sitting with a CFO, someone on leadership tomorrow morning. I don't want to create panic, but I also don't want to understate the urgency. What should I be telling that employer to do right now? Specifically, how should they be looking at their plan for active members over 65, dependents, and any plan wording that might still have those age-based limitations?
Yeah, so I think we've got to remember that the age-based limitations are just relative to insured services you can get through the healthcare. So we're not necessarily talking about long-term disability or life insurance. It's really the health items and in particular drugs. And so I think the first step is, do you have employees that are over 65 that are not on the plan? And you're allowed to still look at them like you would a regular employee. So, for example, are they working in enough hours a week? It doesn't mean you have to let everybody on. You can't do anything different with them relative to a similar employee. So, if you have a part-time employee that's not eligible for benefits and an over 65 part-time employee, that doesn't mean you have to give them benefits. So, I think that's a key thing. But I think the first step is, do you have anybody in this category? Um, you know, to assess whether or not you need to look at it.
Okay, perfect. I think that's really helpful. One last nuance I want to make sure advisors understand, so perhaps you can help us here. We're talking a lot about drugs shifting and private plans becoming first payer, but pharmacy clinical services are a little bit different. Should advisors be telling clients those services are shifting to the private planner as well, or are they staying with the province?
So essentially, it's just that the province is becoming a payer of last resort. So if there's something that is normally covered by the province that could be covered in the benefit plan, that's what needs to go over to the benefit plan. So, for example, there was a lot of discussion today in the working group about semi-private hospital room or private hospital room. The way the legislation is written is that they're talking about ward coverage, and that if there's ward coverage available in your private plan with your group, it should be covering that. But you know, this is the issue with some of the language is that we know that private group plans don't cover ward coverage, they cover semi-private or private. So these are the things of the nuances of it, but it's really those items that, if an individual over 65 was using the drug plan provincially, but is eligible now for that group plan with their employer, those drugs would first go through the plan. Now, there is the example that if they apply for a drug in the plan you have and they don't go through the prior authorization or they're declined for prior authorization, it could still then go back to the province as a payer of last resort, but it has to go through that primary employer plan first.
Now, Graham, I was also in the room at the table. We were at together today, and there was a few comments around, what about the brand coupon cards or the compassionate drug or individual programs that are offered, and never mind Alberta having the biosimilar policies as well. Can you speak to us a little bit about that, of what we learned today?
Yeah, so that there was a lot more questions about that than answers. So the big question is, so there's really two kinds of patient support you can get from a drug manufacturer. One is a coupon card. So, for example, allowing somebody to stay on a brand drug when their plan only covers a generic. And then the other side of it is more compassionate. Somebody has a 20% out of pocket cost for an expensive drug, and they can't really afford that. So sometimes a drug plan or a drug company will kick in for that 20%. So it's not clear how that's going to work. I did raise the question that I would worry that drug companies would stop doing some of that compassionate work, because if they just leave it, that 20% could potentially go to the province as a payer of last resort if it's an eligible drug on the provincial formulary. Maybe that's the route they're going to go. It's very unclear about those coupon cards. My suspicion is a lot of those brands wouldn't be covered under the provincial formulary, but we're going to have to find that out.
Thank you, Graham. And that indeed is the power of this distinct voice. Being an advisor and sitting on the Bill 11 working group, SHBA is bringing the exact compliance intelligence that advisors and employers will need to know to protect clients before that October 1st deadline. For those of you listening, if you are not yet a member of the Smart Health Benefits Association and you're an advisor, this is where you're going to get the information. So we have our podcasts. We widely want to educate everyone what's going on, but you need to be aware there are some members-only information and client tools that will be available to you. So click the show notes to join SHBA. The value of this investment is going to pay back in terms of your advice to a client and your value there. So thanks for joining us today, Graham and Robin, and be sure to tune into the next episode. We've got another Alberta Bill 11 series coming up, and we have a webinar coming up that is also available to all. So check out the show notes, and we'll see you soon on the Alberta Bill 11 series. Subscribe to Advocacy in Action because we will continue to bring you real-time updates straight from the legislative table. Thanks for tuning in.